Hello, and welcome to this on-demand recording of our Seizure Smart Parent and Guardian training from the Epilepsy Foundation of Minnesota. My name is Eric Williams, and I am the Regional Outreach Manager for the West Metro. I'm happy that you signed in today to watch this training, and let's get right into it. So our objectives for our training today: we want to define epilepsy and seizures. We want to identify the 4 leading types of seizures, and then learn the appropriate responses to those seizures. And then we want to increase our knowledge of the available treatment options and gain information about safety and supports that exist for raising a child who lives with epilepsy. So let's start by talking about what epilepsy actually is. Epilepsy is a neurological condition characterized by unprovoked recurrent seizures. So neurological, meaning that it is happening in the brain, and then unprovoked, so these seizures are happening without a direct cause, and then recurrent, meaning that the seizures are happening more than once. You may also hear someone who refers to epilepsy as a seizure disorder or seizure condition. And those terms really can be used interchangeably with epilepsy and mostly mean the same thing, and is just personal preference for what someone decides to call their condition. At the foundation, we prefer using epilepsy because it is the most descriptive for what is happening in your child's brain. So some key epilepsy facts: epilepsy is not contagious. You can't catch it like a cold. If you're helping somebody who is having a seizure, you are not going to start having a seizure yourself. Then epilepsy is not classified as a mental illness, such as ADD, anxiety, or depression. Sometimes somebody may show some cognitive issues while having a seizure or from side effects from anti-seizure medication, but epilepsy itself is not a mental illness. Epilepsy also exists on a spectrum. Each case of epilepsy is very unique, and someone on one end of the spectrum may take one medication in the morning for the rest of their life and never have another seizure. Another may take 2 or 3 medications 2 or 3 times during the day and just have one seizure a day. And someone else may never find good control over their seizures with medications or other treatments and have hundreds of seizures during the day. It's very unique. And lastly, people rarely die from having a seizure. It is dangerous to have epilepsy, but if people are well trained and know how to keep somebody safe during a seizure, it is rare for someone to die. We will talk later about some ways that it is possible, but to cover right at the start, it is rare for that to happen. When we think of current prevalence of epilepsy, it's very important to know that 1 in 26 people will develop epilepsy at some point in their lifetime. And so that means you can be born with epilepsy. Somebody can develop it when they are 5 months old, 15 years old, 20, 30, 60, 70, 80, 90. At any point in somebody's life, you can develop epilepsy, and you wouldn't necessarily have shown any signs that that would be the case earlier in your life too. But even more common than developing epilepsy is having a seizure during your life. So 1 in 10 people will have a seizure during your lifetime. And so it is very important to know the steps to take when somebody is having a seizure to help keep them safe, because even if someone or everyone you know doesn't have epilepsy, maybe one of them will have a seizure at some point in their life when you're around, and you'll be there to help with this knowledge. So in Minnesota, approximately 54,000 people have epilepsy, and throughout the United States, there are almost 200,000 new cases of epilepsy and seizure disorders diagnosed each year. So it is really more prevalent than what you may have thought of originally. So some other statistics about epilepsy: it is the 4th most common neurological condition in the general population behind migraine, stroke, and Alzheimer's disease, but it is the leading condition, brain condition in children. And so about 1/3 of people with epilepsy live with uncontrolled seizures, so they haven't found a treatment that works well for controlling their seizures. And adults who have epilepsy are more likely to have 4 more co-occurring chronic conditions as well that happen with epilepsy. So something like sleep disorders or anxiety or depression are all more common to happen with someone who has epilepsy. So some demographics in the United States, it's important to know that anybody at any age can develop epilepsy at any time, but their race, their social economic status, where they live can all have an impact on how big of an effect epilepsy has on their life. So people with low economic status are 2 to 4 times more likely to have seizures than those in regular economic status. African Americans and Hispanics account for nearly 40% of people who are diagnosed with epilepsy every year, and they only make up about 31% of the population. So there is a disparity there. 1/3 of children with epilepsy live in food insecure homes, and compared to the general population, that's 1 in 5 children. So it's more likely for kids who have epilepsy for that to be the case. And then 50% of adults with active epilepsy have annual family income averages of less than $25,000 a year. And that's compared to just below 20% of adults without epilepsy who are making less than $25,000 a year. So you can see it really has a strong impact on these different communities or different statuses in life. So some leading causes of epilepsy, of the causes that we know of, anything that damages the brain could lead to epilepsy. So a head injury, a traumatic brain injury, a stroke, a brain tumor or lesion, or maybe the brain didn't develop correctly in utero, or there's a brain injury at birth, that could all lead to epilepsy. There are also some epilepsy syndromes that are caused by mutations in the DNA, so specific genes that did not develop correctly or are mutated could lead to an epilepsy diagnosis. But even bigger than those percentages is that almost in 70% of the cases, cause is unknown for somebody's epilepsy. So there is still a lot of mystery involved in the field of epilepsy. And it's possible for a majority of people who have epilepsy, they'll never know why they developed it in the first place. So what is the actual seizure? Seizures are sudden and they involve brief, uncontrolled electrical activity in the brain. So when we are presenting this information to children, we'll say a seizure is kind of like a brainstorm or a crash in the brain of all that electrical activity. But basically is somehow that brain activity is malfunctioning and is not working properly, and all of that energy that builds up releases in that seizure. And so seizures can occur with other conditions. So seizures that are non-epileptic in nature, so they have a cause, could be a high fever, an infection, maybe a blood sugar emergency for someone who has diabetes, or potentially drug or alcohol use. But those seizures are non-epileptic in nature because there's that direct cause for why they started. So seizures in epilepsy are unprovoked, if you'll remember. So depending on where in the brain the seizure is happening or originating, that's going to make the seizure type look different from somebody else's seizure that's happening in a different part of the brain. So you can see our brain picture lighting up in the different spots here. That's really going to be important for our discussion of seizure types, which will come up in a few slides. So some potential seizure triggers. So while seizures with someone who has epilepsy are not provoked, seizure triggers are conditions or environments that make it easier for those seizures to occur. So the main seizure trigger is missed or late medication. So it's very important to take medication at the correctly prescribed time and not miss doses, not skip doses, because that's going to make sure that that treatment is working how it's supposed to. Stress and anxiety can also make an easier condition for seizures to occur. So controlling stress and controlling anxiety can be really important for someone who has epilepsy. Sleeping consistency is very important for those with epilepsy. So making sure that you're always getting the same amount of sleep every night, but also going to bed at the same time and waking up at the same time, because that can be a good way to help control your seizures. And then hormonal changes can also be potential seizure triggers. So in the age range that we're talking about now, especially puberty, can be a very important time for how seizure control might change, or how epilepsy may develop after puberty for some kids. And then around the menstrual cycle too can be a time where there's increased seizure activity. So how alcohol and recreational drug use can be a potential seizure trigger, how drugs interact with other medications that you might take could trigger seizures. And then general healthy living can be a good way to help control seizures. So making sure that you don't overheat, that you're taking enough time to have water breaks and you're not becoming dehydrated. Don't skip meals, and make sure you're eating a healthy diet. Those can be good ways to help control seizures, seizure triggers. And then photosensitivity or flashing lights can also be a potential seizure trigger as well. So now we'll start talking about the different seizure types. And there are actually over 40 different officially recognized types of seizures. And it's really important to help identify the type of seizure, because that informs what kind of steps you're going to take to help respond to them. So the biggest things to think about for seizure types is, one, where in the brain is it located? And the main branches here are, is it focal? So it's happening in just one part of the brain, or is it generalized and taking part in the entire brain? There are some unknown types of seizures too, or unknown locations that happen as well, but we'll mostly focus on whether it's focal or generalized. And then from there, you look at, is their awareness altered in any way? Are they conscious or not? So once you know that, then you can look even further down and see, is there any changes with their movements or with their senses or their behaviors or their speech? And then you add all those pieces together, and this will help you identify the type of seizure that someone may be having. So let's talk about seizure types now. So the first main type we'll talk about is the focal aware seizure. So this was formerly known as simple partial seizures, and the goal with changing this name to focal aware seizures is to be more descriptive for what is actually happening in the brain during the seizure. You may still hear somebody refer to their seizures as simple partial seizures, and that's fine. That's just how they grew up. But focal, meaning that it's focused in just one part of the brain, and aware, meaning that they don't have a change in awareness. So this person during the seizure, that could typically last a few seconds to maybe up to 2 minutes in length, they may still talk during the seizure. They may tell you personally, I'm having a seizure right now. But the different types of these seizures, based on what part of the brain they're located in, could affect their senses. So maybe they have a metallic taste that floods into their mouth during their seizure, or they have a buzzing or ringing in their ears, or their sight kind of pinpoints and blacks out, or colors change, or it could be a movement focal aware seizure. So they have an extension of their hands, or their wrist is rotating in a circle, or they're picking at their clothes in a way that they can't control. Or it could affect their emotions and thoughts, and which could lead to a feeling of unexplained fear or joy or general confusion too. And so with these seizures, since they are typically on the shorter end, what you can do to help is to provide emotional reassurance during and after the seizure for them, help them with recovery if they need it, and then document that it happened, how long it lasted, what it looked like too. Because for all of these seizure types, keeping documentation of when they're happening is really important for care teams to have, and their doctors, to make sure that treatments are working as intended. And if you don't note when you're having seizures, then they'll just think you aren't having seizures and we don't need to change medicines or medications or anything like that. So just documenting them is important for getting the best care possible. Now we'll talk about the other main type of focal seizure, and it's the focal impaired awareness, or formerly known as the complex partial seizure. So focal meaning it's focused in the brain, in one part of the brain still, but now their awareness or their consciousness is altered. So these are typically longer on the scale of minutes, so 1 to 3 minutes in length, and you may confuse them with other behaviors like sleepwalking or intoxication. So this person who's having a focal impaired awareness seizure, they may display repetitive or purposeless movements. They may have a blank stare. Their speech may become garbled or not make any sense anymore. They may just present as being very confused, and they also may become agitated if you try and restrain them. So before we talk about response for this type of seizure, we'll actually watch a video of someone who's having a focal impaired awareness seizure. Okay, so let's talk about response now that we saw that short example. So the response is always going to depend on the individual and the situation. So if it is your child who has a focal impaired awareness seizure and you've seen them before, your response to it is probably going to be different than this general information that I'm going to share. So I always tailor it to the individual. But first off, you want to make sure that you stay calm, make sure that people around you are calm as well. And then for this seizure now, you want to start tracking the time. So it's very important to track the times of seizures, because then you know first that you can document that and tell that to your doctor. But then second, once you've had a couple of seizures, you might know what a baseline or regular seizure looks like and how long it lasts. And so if you're tracking time, then you can see, okay, this is a normal situation, or it's potentially lasting longer than what we've seen before. So maybe this is becoming an emergency situation. So starting that stopwatch, starting your phone clock, that's really important for to know how long these seizures last. And because someone who's having a focal impaired awareness seizure, their consciousness is altered, they're kind of in a fight or flight mode. So if you try and restrain them, hold them, they may push you away and hurt themselves. They may hurt you trying to do it. And so it can really just agitate them in a way that is not helpful during the seizure. But since they may be moving around, they might be moving towards the staircase or out into the busy street. And so the best way to help keep them safe is to come up from behind them and gently put your hands on their shoulders and just kind of angle them away from the hazardous situation. So then you can stay in between them and that street or staircase and just stay with them for the rest of the remaining length of the seizure. So stay with them until they've gained full awareness, and then you're around to be able to help with recovery. So whether they need to lie down, rest from a headache or anything like that, just work with them to make sure you're helping them as best as possible. And then lastly, document what you saw, how long it lasted, what parts of the body were involved. Just all of that information is helpful for doctors to know. So we're going to move now into the generalized seizures. And so generalized meaning that it's taking over the entire brain. So these next two types of seizures always result in a loss of consciousness. So the first one we'll talk about is the absence seizure. So this was formerly known as the petit mal or petite mal in French seizure, and which is French for small bad. So the idea for the name change is to make it so a medical condition that you have and have no control over doesn't have a word in it that is bad. And so absence seizure is a brief and sudden lapse of awareness. And typically usually just 5 to 20 seconds in length. And so they can be really short, and you may even confuse them for daydreaming or attention issues. So they may just look like brief staring off. Their eyes may roll back in their head, or they'll lick their lips or smack their tongue in a different way. But after those few seconds pass by, they'll quickly return to typical awareness. So with the absence seizure, what you can do to respond to it is really just track the time, if it's long enough to even get your time or your stopwatch started, and then document when it happened. So we are going to watch a video of a girl who's having an absence seizure, and just pay attention to really how quick this can come and go.
This girl has absence seizures, and you will see her have one while she's talking.
Because he can be as heavy as ever.
And there's a real blankness, a vacant look in the eye, and then all of a sudden they're right back with you and able to engage.
So once again, yes, you could really see how quickly that happened, and the girl came right back to and was able to kind of see that maybe she missed something, but during that time of the seizure, they are completely unconscious and so won't remember what just happened. So now we'll talk about the generalized tonic-clonic seizure. And this type of seizure is definitely the most commonly thought of seizure. It's not actually the most common type of seizure, but when you tell someone or talk to someone about seizures, this is likely what they are picturing. So this seizure was formerly known as the grand mal seizure, or big bad in French. And you'll still hear people using that term, which is fine. That's how they grew up with it. But the generalized tonic-clonic seizure is typically 1 to 3 minutes in length, and a typical stage, or the typical stages of them, might include a sudden cry or moan and the loss of consciousness. So that might be a fall to the ground or slumping out of the seat that they're sitting in. And then in the tonic phase, that's the extended rigid body. And then in the clonic phase, that's rhythmic shaking and jerking, or the convulsions you might start seeing. And some additional effects may be present too, like loss of bladder control or vomiting too. And so after one of these seizures is over, this person may feel tired, sore, confused, they may have a headache. Some individuals may be ready to continue on with whatever they were doing immediately after the seizure ends, and some may need a full 24 hours resting up before they feel like they're back to their normal selves. So it's unique for each person. So let's watch a video of a girl who's having a generalized tonic-clonic seizure, and then we'll talk about the response steps that you can take to help somebody who's having a GTC seizure.
They affect the whole brain and the entire body. The tonic phase is the stiffening of the muscles. Then the jerking movements begin, the clonic activity that you see here. A tonic-clonic seizure rarely lasts more than a few minutes. A person having one isn't conscious and won't remember what happened. The skin may become pale. Breathing may seem shallow or labored. Sometimes a child may lose bladder or bowel control or vomit as the seizure ends. These seizures may look painful or even life-threatening.
Okay, and to finish off the narrator's thought there, they may look painful or even life-threatening, but if there are people around this person who's having a seizure who are well-trained in how to keep them safe, since they're unconscious, they're not feeling anything during the seizure, and the safety steps that we'll talk about next can help keep them safe as well and make it so these seizures are not life-threatening. So response steps are obviously going to depend on the individual still, and you want to stay calm too, make sure people around them are calm, but time the seizure from the beginning. So right when you notice that, usually that kind of cry and that loss of consciousness to the end of the seizure. So typically when those convulsions end. And so that's important for documentation purposes, but also to know, is this a baseline normal seizure, or is maybe this an emergency situation because it's lasting longer than anything you've seen before. So turn this person on their side. You could see in the video saliva building up in the girl's mouth. And so keeping them on their side makes it so that saliva doesn't present a choking hazard. And so on their side, it has a place to drain from. So cushion their head with a pillow, blanket, sweatshirt, your lap if you need to make sure their head is protected. And then remove any clothing or accessories that may get in the way of response or cause further injury. So maybe that's glasses, top buttons, ties, maybe necklaces too that could get in the way of the breathing. And then move furniture out of the way too. Just create a clear open space for their body to move unimpeded, and so they're not banging on different things. And stay with them until they're fully aware. You never want to leave somebody by themselves who's having a generalized tonic-clonic seizure, or really any seizure for that matter, especially though for the generalized tonic-clonic seizure, because they may end up on their back or face down in the ground, and that can present that choking or suffocation hazard. So stay with them, call audibly for help if you don't have your phone, or just reach out for people to make sure they can come assist as well. So two other additional types that we'll talk about that are not the main types, but you may see them more in children, are the atonic seizures, or drop attacks, or drop seizures as you may hear them called, and the myoclonic seizures. So atonic seizures are just really quick head drops or collapses, weakness or droopiness of the body, and they can be so fast and abrupt that even if you're walking next to the child, they could fall and you wouldn't have any time to react and to catch them. And the myoclonic seizures, they're really brief but rapid contractions of the muscles that usually occur at the same time on both sides of the body, but really it can be a hand jerk, it could be a leg kick, and repeat patterns, and those can often be seen as sudden jerks or clumsiness too. So we'll talk about how you can respond to these, but let's watch two videos of an example of atonic seizures and then myoclonic seizures as well.
Kit again.
Come on, lads, get a move on.
So I've got no kit.
It's all right. There'll be something in the cupboard you can use.
You can wear those red shorts again, Lee.
Andy?
Andy? Andy? Andy, you okay? Yeah?
So is he gonna be okay?
Yeah, he's fine. Yeah. You two go and join Miss Macon in the...
So you could see with that just how quickly the head drooped down, and imagine if he was standing at that point too, and that might have resulted in a more dangerous fall to the ground. So now here comes the myoclonic seizures.
Uncontrollable jerks of a muscle or muscle group, which tend to last a few seconds. These can often be misinterpreted as a nervous tic, since they tend to be non-violent and the child does not lose consciousness. Usually, these tend to happen in the morning, but can also occur during sleep, which are then characterized as jolts.
Right, so you could see it's just very, very kind of almost subtle jerks, but it is affecting the brain in a seizure, and that can, if you're having lots of myoclonic seizures as you're growing up and developing, that can lead to different developmental delays too, as your brain is trying to process and figure out, work through all these challenges. So the additional responses for these seizures, for the atonic seizure, if you're able to catch them, just lower them down to safety. But if they are uninjured after the seizure, you can have them continue on with their activities. But if they fell really hard and hit their head, or their arm doesn't look like it's in the right spot, call 911 to deal with any injuries. Then on the other side, the myoclonic seizures, they really require proper documentation, how many jerks you're seeing, how long the kind of cluster lasted, provide emotional support for them, and if they're uninjured, let them continue on with their activities. So Also, another thing that we want to make sure to talk about, especially for in regards to parents and guardians, are infantile spasms, or you might hear them called West syndrome. So infantile spasms are sudden stiffening of the body, and it might be brief bending forwards or backwards of the arms, legs, and head. So these are really short, usually just a second or two long, and they kind of happen in a series. So they're usually most common just after waking up. So that's when you might see these too. And unfortunately, for diagnosis' sake, you may think that it might just be colic for these babies, because it usually begins between 3 to 8 months of age and ends when they're about 4. So in that age range, colic could be common. Reflux or gastrointestinal stuff is semi-common, or an exaggerated startle reflex. So you might think that that's just what it is, but it could actually be a seizure that's happening. So most children who have infantile spasms or West syndrome have developmental disabilities later in life, just because it's such a crucial time at this age of brain development, and these seizures can interrupt that. So it's really important to see the signs of these and recognize them. And if you are seeing them and thinking this doesn't quite look right, take a video of them, because recording them and asking your doctor about them immediately provides more evidence for what's happening, as opposed to they do this thing in the morning, but you see your doctor in the afternoon and they'll never see it personally. So having that video evidence is really important for potential diagnosis. So, and once you do have a diagnosis, maybe that's through that video leads to a EEG test, then the treatment can usually might be steroids, it might be anti-seizure medication, but that treatment is really important to maybe prevent some of those developmental delays. So now let's watch a quick video of an example of infantile spasms. So if you think back to when your child was this age and all the different movements that you saw, you could see how some of those things that we just saw in the video can look really like normal behaviors that you saw with your own children. So infantile spasms are really important to kind of diagnose and get help for. So now let's talk about febrile seizures. So febrile seizures are actually a seizure that is non-epileptic in nature, because it's convulsions brought on by a high fever. So the symptoms really look pretty similar to the generalized tonic-clonic seizure. So you might see loss of consciousness, twitching or jerking, those convulsions, difficulty breathing, and their eyes rolling back in their head. So this most often occurs in children between 6 months to 5 years of age. And so response for them, think about taking the same steps as you would if it was a generalized tonic-clonic seizure. So time it, keep them on their side, keep them safe from things around them, and stay with them the entire time. So a febrile seizure that lasts longer than 5 minutes or keeps repeating itself in a short amount of time, that is considered an emergency, and you will want to call 911 right away. So, and a child who has experienced these seizures should be seen by a doctor, so that doctor can determine what the source of this fever is. Is it an infection? Is it going to last for longer than just a normal flu that kind of runs through, or anything like that? And so when these seizures happen, they should still be seen by a doctor, even though they aren't technically related to epilepsy. So some reasons why you should call 911, for the most part, seizures, if they look like what you have seen before and last that same amount of time, they're not medical emergencies. And even if you did call 911, an ambulance or help wouldn't get to you before the seizure is already ended and maybe they're recovering. So they wouldn't really be able to do much to help. But some reasons why you should call 911 is, one, if it's a first time seizure. So if you don't know or your child has never had a seizure before, then you should definitely call 911 because maybe they are on their way to an epilepsy diagnosis, but maybe it is a febrile seizure or it's from a high fever, and a doctor can help treat that seizure or that fever as opposed to looking to see if maybe epilepsy is on the horizon. If an injury takes place during the seizure, so they have hit their head really hard or fallen down some stairs, you should call 911. Breathing does get affected during a seizure. And so if it doesn't return to normal after the seizure ends or just breathing stops altogether, you should call 911. Status epilepticus is the name for when a seizure lasts longer than 5 minutes. And that's a general guideline for calling 911 is if it lasts longer than 5 minutes, because that status epilepticus is usually only stopped by powerful medicine through an IV at a hospital. But if you know your child should have 911 called if a seizure lasts longer than 3 minutes or 2 minutes, that is completely fine. You should always work off of a more specific guideline for an individual rather than the more general over 5 minutes. If a seizure takes place in water, it can be really dangerous for any amount of water to be in somebody's lungs. So anytime that happens in water, you should be checked out at a hospital or monitored to make sure that you don't have a dangerous amount of water in your lungs. Other health conditions that would apply for children would maybe be if they have diabetes, to make sure their blood sugar is regulated. And then for the other main condition is for pregnant women, to make sure that the baby is okay. Lastly, if you feel like you can't respond appropriately, there's no shame in calling in professionals who are trained to help with this. So we mentioned it at the start, but it is rare to die from a seizure, and most seizures are not considered an emergency. But it's possible for someone to die from complications from a seizure. Maybe it happened in a really exposed, dangerous area or place. Status epilepticus, so as a seizure that just didn't stop and the person passed away from that seizure lasting too long, or any accidents associated with seizures too. But the most common form of death in epilepsy is SUDEP, so sudden unexpected death in epilepsy. So, and really this applies to a sudden death for someone who is known to have epilepsy, but there's no other obvious cause for their death. So SUDEP, it's some combination of breathing failure, heart failure, failure with the circulatory system. It's not clearly understood, but it does affect about 1 in 1,000 people who have epilepsy. But it does go up, it is a higher risk for some people who have had epilepsy for a long time. So maybe they were diagnosed as young children, but now they are in their 20s or 30s, and so they've lived with epilepsy for a long time. So that's a higher risk factor. And also people who have uncontrolled seizures. So they haven't found any treatment that works well for their epilepsy, or they're not taking their medications regularly, could expose them to this higher risk. And then also having seizures at night could potentially raise your risk factor for SUDEP. So now let's talk about treatment options. So how are doctors and care teams working to try and prevent more seizures from happening? So first we'll talk about medications. So medicine is the primary way in which seizures are controlled, and it's almost always the first therapy that a doctor is going to try to help control your seizures. So different medicines are made to help with different kinds of epilepsy or different types of seizures. So when you have an epilepsy diagnosis, you might cycle through many different types of medicines, just trying to find what is going to be the most effective for you. Luckily, medicine does help control seizures for about 7 out of 10 people living with epilepsy. So there is a good rate of finding efficacy with medicine. And it's also really important to never stop or change your medications or your child's medications without first talking to your doctor. So effectiveness for medication, it's highest likelihood of gaining seizure control when you take your first medication. And then it goes down with every subsequent medication that you take, which is just to show that if it doesn't click in with that first attempt, it might just be harder to, your epilepsy that you have might be harder to control. And so there are side effects that are associated with taking anti-seizure medications, and those can really vary by what medication you're taking, how long you've been taking it for, and just the individual who's taking it. So some of those possible side effects may be displayed as physical, it may be emotional, social, and cognitive too. So some effects you could see might be lethargy, it might be hyperactivity, weight gain or weight loss. It may cause some problems with your concentration. You may have memory lapses or difficulty remembering things. And it could also be emotional or behavioral changes. So for the most part, side effects are most prevalent in the first few weeks after you start a new medication, but sometimes some people are just going to settle into having side effects for taking medication, which they balance versus having seizures. So they may decide that it is worthwhile to have issues with your memory because it means you aren't having as many seizures. So it's always a balancing act. So tracking side effects is really important too. And so it really revolves around a comprehensive evaluation of both what you see at home and what might be happening at school or daycare. So always communicate with your child's school or daycare about what potential side effects may be. Give them a heads up if you're starting a new medication, and then ask them to report back what they see. They may see your child for more hours during the day than you do, and so can be really helpful in telling you, this is what I'm seeing, this is how they're affected by the medicine. And so have them keep track in a notebook. There are apps for phones that you can jot down these notes in, but just have some defined method of how you're going to keep track of side effects. Because like I said, with that balancing act, if your child isn't able to wake up before 10 a.m. in the morning because they're so sleepy from their medication, that's going to affect the rest of their day. And maybe you need to talk with your doctor about finding an alternative to make it so they can function better in the morning and not be so tired that they aren't doing well at school, or they're not even able to get to school because they're still asleep. So keep track of side effects and include your doctors in what you're seeing with those. Emergency medications, these are typically used for seizure clusters or when seizures are more frequent, longer, or severe than typical. So these are separate from daily seizure medication, and you may or may not be prescribed one if the doctor thinks it is relevant for your child. And so these are taken as needed to prevent a seizure emergency from occurring, and each individual's definition of seizure emergency is going to be different, and you should work with your doctor to kind of define, what does that mean for my child? And emergency medications do come in different administration forms. So it could be rectally in a gel in the rectum, buccally in the kind of lip or the cheek, or nasally in a spray too. And so these medications, they have to be easy to use, they have to work quickly, and fit the individual who's using them. And they have to work well too. Some people who we work with have never seen a seizure stop by themselves or by itself. And so they always use an emergency medication whenever a seizure starts. And then other people have had an emergency medication in their back pocket, in their backpack, wherever they go for decades and have never had to use it too. So once again, can be unique for each person. Brain surgery is also an option for a treatment. It's typically done though when the other forms of therapy haven't been effective. So you've tried lots of different medications, maybe you've tried diet like we'll talk about next. But brain surgery is going to depend, or the type of surgery is going to depend on where in the brain the seizure is happening. So where those neurons are being affected, and then the age of the patient too, because there can be more trade-offs with brain surgery as well. If you are resecting or taking out a part of the brain that controls certain life functions, can you live without that ability and balance that with having less seizures? And so that could be a type of surgery. It could be laser thermal therapy, so kind of scar or burn that section of the brain, or hemispherectomy is splitting the two hemispheres to make it so seizure activity doesn't travel through the entire brain too. So brain surgery is always going to depend on the neurosurgeon and whether they see something in your testing that says brain surgery could be an option. Another surgery type is adding an implanted device. So this is basically what you can think of as a pacemaker, but for the brain. So the stimulation devices is inserted, and then wires lead to different parts of the brain or different parts of the body to deliver electric activity to the brain to either stop a seizure that has already started or to just shorten them. And so the VNS, the RNS, the DBS, they're all a little bit different, but the basic principle is the same, that you're adding in an electrode that sends electrical activity to the brain with the goal of positively affecting your seizures that you have. The ketogenic diet was actually invented over 100 years ago as a treatment for epilepsy. And so this extremely high fat, low carb diet was designed to change brain chemistry to help control seizures. So the keto diet is very strict though. You limit your fluids, you need to measure all of your foods to the gram, and even includes a short fasting period in the hospital before you even start on the diet. So, but if you can follow the diet or have your child follow the diet, it can have some really positive effects for seizure control. And then finally, medical cannabis is also an option for seizure treatments. In Minnesota, epilepsy does qualify as a condition under the Minnesota Medical Cannabis Program. And so if your doctor certifies that you have the condition, you can register with the registry. And then once you're registered, pick up cannabis products from any of these places in the state of Minnesota. It's important to note in Minnesota that there is not a smoke form of cannabis. It's just pill, liquid, or oil. And another piece for students is that medical cannabis is not FDA approved for treating epilepsy. So school nurses are not able to give this medication or cannabis to students while on school grounds. So we know families who give their student their dose of cannabis in the morning before dropping them off at school, and then picking them up at lunchtime and driving a block away off of school grounds to give it to them and driving them back. So that's just an important consideration to take in. So safety in epilepsy, it's really important to not just think about the seizure itself, but think about your surroundings as well. So think about when you might be having seizures and then create response plans for how to handle them or how to deal with them, and make sure that other people who are with your kids know those response plans as well. So daycares, schools, sports teams, church programs, whatever other gathering places your child may spend time, make sure the adults in those locations know what to do if your child has a seizure. Know where you're keeping your medication and that you have it safely contained, so you're not taking more than necessary. Safety in your environment can be really important too. So in your student's classroom or in their bedroom, make sure there is extra soft rugs around if they are prone to falls. Cover up sharp corners of desks, of bed frames, things like that. If you are swimming in the water, make sure that an adult is close by if they may have a seizure in water. We always say it's safer to shower rather than take a bath, because then the absence of standing water can help really reduce the chance of drowning. And then fire too, make sure there are safety measures in place around maybe any fireplaces you have in your home or fire rings outside, that your child, if they love to cook, that there's someone there who can help supervise, that they're not cooking over a gas stove where there's that exposed flame, maybe lead them or direct them to use the microwave instead. And students, kids who have epilepsy, they are definitely allowed to play sports and join clubs and go to sports camp too. Really, the only thing that doctors would say that you should stay away from in terms of activities is skydiving, rock climbing, and scuba diving. So anything that's really high up in the air or down below the surface, just because of complications that can happen there naturally, or even to someone who doesn't have epilepsy, they can be life-threatening. Just adding epilepsy to that picture can be a dangerous thing. So really allow your kids to join sports, be social, don't let epilepsy try and to hold them back from making those connections. And then driving is allowed as well in Minnesota. We'll talk about those rules in a few slides. So the seizure action plan, like I talked about, that you should have logged with your schools or your daycares, is really important because it will include emergency contact information, what your child's seizure types are, what are some signs that they are happening or maybe might start to happen, how long these seizures last, what their current treatment plan is, when do they take their medication, do they have implanted devices that they need to know about, and then how do you respond to seizures? So who do you call, or who's going to respond to the seizure? How are they going to do it? When are they going to do it? And then, like I talked about, what is a seizure emergency? When should you call 911? When should you use emergency medications? These action plans should lay out all of that information, and writing this up with your doctor is always a good idea too, because they can help fill in some of that medical side too about safety plans. Some seizure safety devices that you may want to consider is these are always considered or can be a good idea for parents, especially to help increase independence of their kids and to help themselves sleep at night, because you may be really worried about a seizure happening in the room next door. So these might be wearables or monitors, mattresses, or pillows. And so most of them are useful in letting other people know that a seizure is occurring. So these pictures that you see on the side here, there's kind of an action motion activated camera that will pick up seizure activity and will sound an alarm. This watch looking technology kind of sends a text or an emergency phone call to anybody who's listed as the emergency contacts with the phone's associated app too. So it can really provide peace of mind for parents to know when a seizure is happening and allow them to come to their child's assistance. And some of these devices actually record events too and make it easier to share with doctors. So I talked about driving, or that we talk about driving. In Minnesota, obviously it is not safe for someone who has uncontrolled seizures or that may happen at any time. It's not safe for them to drive. But if your child, or your, I guess, driving age child, if they have been seizure free for 3 months and their doctor has signed off on it and said, you know, they are not a safety risk here, driving may be possible. So As long as you don't have a seizure, then you're allowed to drive. But if you do have a seizure, even if it is not on the road, it happened at night in bed, that seizure still represents a reason that you should self-notify the state and have your license suspended until you've had another 3 months of seizure-free period. And so if you drive and do have a seizure, you should stop driving right away. Talk to your doctor. Why did this seizure happen? Do we need to talk about my medication regime? And just reevaluate your health to make sure that it's going to be safe for you to start driving again once you have this period of seizure-free activity. So far we've just talked about how epilepsy or how seizures affect somebody's life, which may be just a few minutes long of a day or maybe even a month. And so it's really important to think about the entire person, your entire child, and how all of the rest of their life is impacted by epilepsy, because it can have emotional effects, social and psychological effects, could cause isolation for them. And then for you as parents, how does it affect your finances and insurance and healthcare? And how does that trickle down to your child too? So these challenges that individuals and their families and caregivers face can be around the stigma of having epilepsy or discrimination of not wanting to have them join a camp or a sports team because what are we going to do if they have a seizure? And then the individual too, there's just so much unpredictability of when seizures occur that it can lead to a lot of fear for children and their families too, of maybe we should never try anything new because it might trigger a seizure, and we need to be very predictable and be very safe all the time and shelter our kids. And so all of these can add up to a really challenging situation to grow up in. Epilepsy can also have impacts on learning and behavior. And there's a really strong association between having seizures and epilepsy and having an impaired self-image or having self-confidence issues. There can be a lot of shame or embarrassment around having epilepsy, a low self-esteem, having anxiety, having delayed social development too. So those can all have a really big impact on a kid when they go to school or join teams. So it's always important to know that it may be medication side effects that are impacting their cognition or memory, and that could impact their learning and behavior too. So it might not just be the seizures, it may be a medicine that you're taking. So bring up any concerns with your doctors. And then talk with teachers too. After a seizure happens, make sure they know that maybe coursework needs to be retaught or your student needs extra time for assignments too. And just always remind teachers and your school faculty, if they're having difficulties in school, it's not just because they have epilepsy, or it might not be just because they have epilepsy. There can always be other things involved with it. So make sure that they are taking the time to think about your whole child as well, and not just focusing in on their epilepsy. And then kids who have epilepsy, ADD or ADHD is seen in up to 40% of them too. So those kind of there's a stronger link between those things and kids who have epilepsy. So, and lastly, we want to talk about how this impacts the family. Epilepsy or a child who has epilepsy can cause an immense amount of stress on their caregivers, their parents. It can be a financial burden and paying for medications every month. The amount of time you have to take out of your day to help care for a child with epilepsy, from just going to appointments to maybe the time that you spend worrying about them at school instead of focusing on your work at hand. How it might limit your social and family life. You don't want to travel as much or go out to eat because something may happen. And then just a fear of death or the fear of that worst thing happening to your kid when you drop them off somewhere. And then it's also important to think about how epilepsy affects a sibling too. These siblings may try and feel like they need to grow up and mature quicker, so they can help the family. They may keep their worries or things that are happening to them to themselves because they think their parents can't handle that as well as looking over, taking care of their other child with epilepsy. And they might not even know a world without the impact of a chronic health condition, just because they're so focused on their family in their home too. So some tips for how you kind of care for the caregivers, which both includes parents and siblings. Make sure that they take care of themselves too, because they can really lead to a negative situation. So schedule alone time, do what brings you peace and joy. Find others who understand the journey of epilepsy, reach out to other families, connect through the Epilepsy Foundation of Minnesota. We have parent connect groups. We have connect events for kids. Camp Oz is a camp designed specifically for kids and their siblings who have epilepsy. And so with the siblings, schedule one-on-one time with them to do what they like and need. So feel like they're not missing out on that attention. Encourage siblings to play and acknowledge that sibling fights are normal. Welcome discussion about epilepsy and fears and concerns that all the family members have. Keeping it out in the open can really do a lot of good to make sure it doesn't become a negative situation. And then just include the child with epilepsy in family discussions. You don't need to try and shelter them away from the hard things. They're going to have more ownership in their life and feel more connected to the family if they are included in discussions. So the Epilepsy Foundation of Minnesota offers free one-to-one support through our information services program. And so we try and offer customized tools and resources about a variety of epilepsy related topics. So anything that might even be cursorily related to epilepsy, we can try and help with. So whether it's about 504 and IEP plans at school and including epilepsy in those, we can try and offer help with. Hospital or clinic referrals, mental health referrals for providers, how things may side effect information, new medication information, anything. We just want to help however we can. And so to get started with that, that is our link on our website that you can use to connect with somebody at the foundation. So at the Epilepsy Foundation, we lead the fight to overcome the challenges of living with epilepsy. And we try and accelerate therapies to stop seizures, find cures, and save lives. So we, just by listening to this training, you are helping with that first part, whether you're helping or listening for your child, your grandchild, a neighbor across the street, you are helping to overcome the challenges of living with epilepsy, because the more people that know about seizure first aid and those steps to keep them safe, the safer the world will be for them, and they can know that people around them will be able to take care of them if a seizure does happen. If you have any thoughts about this training, please follow our evaluation link, or if you would like to donate to the Epilepsy Foundation of Minnesota, that is the link for that too, to help support our programs like information services or our camps or our connect groups. And lastly, that is my information. If you have additional questions, please reach out to me and I'd be happy to help you however I can. So once again, thank you so much for taking the time out of your day to view this training. And I hope it makes a difference with you and your family. And reach out if you have extra questions. Thanks so much and have a great rest of your day. I will play through our references pages here at the end of the training if you want to follow any of them. Take care.